According to the World Bank, progress towards reducing inequality has been slow, and as a result, Namibia is one of the most unequal countries in the world, and this slows the pace of poverty reduction. Today on One met with local community hero Samuel Kapepo, who runs a soup kitchen feeding hundreds of children in Windhoek's informal settlements, to find out how the COVID-19 lockdown has impacted his work in the community, as he highly depends on funding from international donors.
I run a charity organization. I do a private tour guiding. Of course, that is more people that are from abroad. You get my point. So, and yeah, it's really affected, man. And I'm very worried about people in a ghetto. You know, people who are in a township. You know, exactly township like here. You know, and there's a different gap between us here in the township and people in the suburb. You see, people in suburb, for example, rich people. You know. They order food, you know what I mean? There's people that bring them food, and here people are going to hustle to buy some tomato, onion, you know what I mean? They don't have fridge, and the cops and police see them and they get beaten up. There's a time that I go individual to people that call me non-stop, and I give them the last food I have in my fridge, and I give them. But as I said, I'm not pointing fingers, and probably this is a time that I need to call the government, honestly, to look at the people in the township, because those are most of the people affected. I'm not risking my life, you know what I mean? I'm going to people that, I mean, I don't know how their hygienical system is what I mean. And I personally have family to feed as well. You know, I have kids, biological kids that I have to look after. Sometimes I cannot list myself, but when I hear people crying of hunger, sometimes I have to list myself as well. Yeah, so it's tough for me, as I said. It's sometimes a kind of like a personal touch to my heart. But it's very touching to me, you know. Of course, I said people calling me non-stop. Kapepo, can we come to your center? Kapepo, can we come to your house? Give us. The lockdown has dramatically affected my people within Namibia, from my community.
The International Labour Organization says that for some who get infected with the virus, it means going on sick leave, accessing health services, and continuing to receive a salary. But for those at the bottom of the income chain, it's a catastrophic scenario, as many are not covered by health insurance and face a higher risk of mortality. Jauch urged the government to put measures in place to ensure that the wealth of the country is distributed equally, even after the crisis hopefully comes to an end.
For people, middle class and elite areas that have their own houses and maybe a yard or a garden around them, they can stay at home. Those who work with computers might be able to do work from home. But for the vast majority, this is not an option. And when we look at the figures, that 40% of Namibians are living in shacks today. In urban areas, the rate could be as high as 70-80%. How can you self-isolate? How can you stay in a small shack with 4, 5, 6 other people the whole day and not go out? How can you protect yourself when you don't even have access to running water? When you don't have access to electricity, you don't have a fridge to store fresh food. And we need to think of ways of ensuring that the wealth of this country is distributed differently and justly. At the moment, we only have a small percentage of the population benefiting from Namibia's wealth, and we've maintained that since independence. This was the case before in even more crude and racist terms, but we've still retained essentially an elite-driven country where the economic benefits are accumulating in the pockets, in the hands of the few. We need to change that, and we need to ensure, on the other hand, that issues like decent housing, decent education and healthcare facilities for all, ablution facilities, access to water and electricity are guaranteed to all. We cannot exclude the majority or a large part of our population from that and then expect that we can cope with a crisis like the COVID-19 has presented to us now.
According to UNICEF, poor children are 3 times more likely to suffer from chronic malnutrition than children from the wealthiest households. Kapepo says that, although he may not be able to travel abroad to source funding for the hundreds of vulnerable children who depend on his soup kitchen for nutrition, he will continue searching for other alternatives to ensure that no child goes to bed hungry in his community.